Hi there, I'm Jay Vega and I'm a volunteer for Junior Achievement. Today I would like to introduce you to my wife. Would you like to tell everybody, the students, your name and the type of work you do?
My name is Nikki Vega and I'm a registered nurse.
Can you tell me a little bit about your job and what does it entail and why did you choose it?
So I've worked as a registered nurse in both a hospital and at a doctor's office. I currently work at a doctor's office. And what I do at the doctor's office is similar in the hospital. I help people. In the doctor's office, I check on our patients who may have gotten out of the hospital recently or who are wanting to come in because they're not feeling very good. Maybe they have a flu or a cold, and I try to make sure that they're getting the treatment that they need, the medicines they need. Sometimes they might need some physical therapy. So just like in the hospital, I work with doctors to try to take care of patients.
Fantastic. What does a typical day what's a typical day look like, day-to-day job?
As a registered nurse, it depends on where you're working. Where I work right now in a doctor's office, I come in and I do sit in front of a computer and I do a lot of computer work, and I have a telephone, so I'll be calling patients. Sometimes I'll go to the front desk if a patient comes in. I think with my job, every day looks different because you just don't know if somebody's going to get sick or hurt. It's not something that you can predict. So it really just depends on the day and how it goes, and you kind of have to be flexible as a nurse.
Sounds good. What do you love about your work?
I love helping people. Before I was a nurse, I was a school teacher because I liked helping kids, and now I get to help kids and adults, and it makes me feel good when I can make other people feel good.
Cool. So let's go back to when you were in middle school or high school. What did you want to be back then? And does it connect to where you are today?
When I was in high school, I wanted to be an attorney, a lawyer, and it does not really connect to what I do now. One thing that did help, though, in school, I took some speech classes to learn how to debate and to do public speaking. And that's helped me as a nurse because I sometimes have to talk to many different kinds of people with different kinds of beliefs. So it helps me to be a good educator. It helps me to talk slowly and clearly. So that has been helpful. But the other things that I learned in high school, like political science, I don't really apply to my nursing job right now.
I can help it. How many different types of jobs have you had, and did all of them relate to where you are today?
I've had a lot of different jobs. They did not all relate to being a nurse, but in all of my jobs, I helped people because that's something that's really been enjoyable to me throughout my entire time of working. I started working when I was 14 years of age, and now I'm older than that.
Well, just a little bit. What was your first job? Talking about your first job was at 14. What was your first job and how did you get hired?
I worked at a restaurant. I was a bus girl or a busser. I would clean people's tables when they got done eating. I would bring them coffee or water or whatever their beverage choice was. And what was the second part of your question?
And how did you get hired for that job?
There was an advertisement in a newspaper because back then the internet was not the big thing, the newspaper was. So we would get the newspaper delivered to us every day, and I was really wanting to save up money to buy my first car. So I would look in the newspaper every day for jobs that somebody my age could do.
Very cool. What did you learn in that first job? Was anything positive or anything negative?
I think most of what I learned was positive. I learned lots of things, actually. I learned how to manage my time because I might have many people asking me for many different things. So I had to learn to prioritize what things were the most important to do first. I learned how to be patient with people because At a restaurant, sometimes, like if somebody wants to order something, they may not know exactly what they want to order, so it might take some time for them to decide, or they might have lots of questions about something on the menu.
Mm-hmm.
So I had to learn how to be patient. I had to learn how to be a good listener and not speak over people. I had to learn how to work with other people because I had a team of people that I worked with. So I learned a lot of things that were good.
Yeah.
Can't think of I learned that sometimes people can be not very nice, especially like if you work in a role where you're a server, where you're serving somebody.
Mm-hmm.
People can be demanding and bossy and not treat you very well. So, but you still have to be kind and polite back to them. So that sometimes can be a difficult thing.
Yeah, I can imagine. I've worked in the restaurant industry as well. Exactly the same sort of learnings there as well. So this job wasn't in the field that you're in today. Why did you change fields?
Well, I've always wanted to be a nurse ever since I was a little girl. I just didn't know if I was going to be very good at it. So after I got older and became an adult and tried out a couple of jobs that I didn't really like, I decided I wanted to give nursing a go because it was something that I still had an interest in.
Yeah, it makes sense. Completely different as well.
Mm-hmm.
Overall, can you share something about the career path that you might find unusual or different that could help the students who are thinking about their future careers? Anything unusual about your career path?
Well, I've had a couple of careers. Nursing is my current and probably going to be my last career because I love it so much. But before I was a nurse, I was a school teacher, and I've been a secretary. I've delivered newspapers. And so there's been some unusual jobs that I've had to get me to where I'm at now.
Mm-hmm.
But I think the important part is that I had to find something I was really interested in. That every job's going to have something bad about it.
Mm-hmm.
There's some bad things about being a nurse, some gross things, some smelly things, some not so pretty things.
Yeah.
So I think if you can find a job that you enjoy doing in spite of the not so great things, then that's a good job for you to have.
Okay. Yeah, I don't think I could be a nurse. I definitely don't like the gross. Let's talk a little bit about education and training. Can you explain what your education path looks like?
So you don't have to have a college degree to be a nurse, but I chose to have one. So I went to college for 4 years and I have what's called a bachelor's degree in nursing. You can have a 2-year degree in nursing at a community college. Nowadays, there's really a push for higher education, but in order to be a nurse, really all you really have to do is pass what's called an NCLEX, or a national board exam for here in the United States. And a 2-year college or 2-year training program can get you to the ability to take that test. Some of the parts of the question?
Yeah, I mean, did this education that you took, did your education guide you to the career that you're currently in? And did things shift along the way? You know, or did things change over time?
I don't know if my education guided me to be a nurse, but I had to have some training.
Mm-hmm.
You know, you have to learn how to take care of the human body. You listen to the heart, listen to the lungs, give medications, give shots,
Mm-hmm.
take blood from people, because you're dealing with a human person. You're dealing with someone that you could cause damage to. So you have to learn how to take care of them in a way that you don't damage them. And you really can't do that without having some training.
Mm-hmm.
And pretty intensive training, because you're learning about all the different parts of the body, the organs, the
Mm-hmm.
muscles, the bones. You're learning about lots of different medications, things that'll help your heart, help your head, help your stomach. You're learning how to look for signs in a person where maybe something's wrong. Sometimes when you're in the hospital with a patient, something's going wrong with the patient and they don't know how to describe it. And so you have to kind of look for other signs. Do they have a fever? Do they have a cough? Are they getting sick, in their stomach a lot? Do they have pain in certain areas of their body? Maybe they have an appendix that's hurting them and they can't really describe that it's their appendix.
Yeah.
They just know their side hurts them. So,
thinking about this and all this training that you had here, what education as well as this training or certifications have you acquired over the years, and do you use them in your daily work?
Yeah, so in order to be a nurse, you have to have what's called a license. And in order to maintain your license, you have to take what's called continuing education. And your license expires, well, at least in the state that I live in, every 2 years. So you have to have a certain amount of continuing education credits to qualify you to renew your license. In the state that I live in, it's 80 hours every 2 years. And those education classes, if you will, sometimes they can be in person, sometimes they can be on the computer, but they teach you a lot of different things. The science is constantly improving. We're learning constantly new things about the body and about medications and about different surgeries. So you have to always continue in your education so that you're kept up to date with the most up-to-date sciences and practices. And we learn in science from mistakes. So if there's been any bad events that have happened, maybe patients were falling a lot in the hospital until we made those magical socks everybody gets with the rubber bottoms on them so they don't slip everywhere. Those are things that we're learning from the mistakes that have been made. And so as a nurse, you need to be constantly learning so that you're kept up to date with how to keep your patients safe.
That sounds good. Yeah. Here's a good one for you. So what advice would you give to your younger self if you had to choose your career path over again? What would you tell yourself?
Well, I would probably tell myself to stick with what I wanted to be in the beginning. Like I had mentioned, I wanted to be a nurse since I was a little girl. But I listened to the advice of older people in my life who had said, oh, you're not going to you wouldn't make a good nurse because maybe you don't have enough patience, or you wouldn't make a good nurse because you don't like blood or whatever. And so I listened to those people and I went different pathways, and it took me probably twice as long to get to where I'm at now than it would have if I would have just listened to my instinct of what I really wanted to do and what I thought I really would like. I would have gotten here faster and less expensively.
Yeah. Yeah, very true. Very true. Are there any resources or any additional information that's important for the students to know if they're interested in learning more about the type of work that you do?
I'm sure there's a lot of really good videos on the internet right now about a day in the life of a nurse, or things that they can. And what I would advise is there's a lot of television shows about nurses and hospitals. That's only partly true of what really happens because it's Hollywood. So to try to watch videos from people who are really doing the real work, not just the character actors from the movies or television. If you have a doctor who has a nurse in their office, maybe talk with the nurse and see what they like about their job or what they don't like about their job. I think it's really important to remember that boys and girls can be a nurse. It used to be that it was just, when people think of nurses, they think of girls, and doctors of boys, and that's changed. So don't be afraid if you're interested in being a nurse to just ask, somebody that's a nurse, regardless of whether they're a boy or girl. And you're going to have to like science So if you don't like science and you want to be a nurse, you might want to find some things about science you like.
Yeah. Yeah, we've got that friend, our friend in England, who's Peter, who's a nurse as well. He's been a nurse all his life.
Yeah.
Okay, we're about to close. Do you have a piece of advice or inspiration to share with the students that are listening today?
I think the best advice or inspiration is to don't give up. It can be sometimes really difficult when you're learning about how to do a new job, whether that's being a nurse or being a tow truck driver or being a waitress. It's new to you, so you're learning. So be patient with yourself. Try to find something fun in what you're learning. And don't give up. If it's something that you really want to do and you really have a dream to do it, don't listen to anything around you that says you can't do it. Just keep working at it and you'll get there.
Keep going. Yeah, I agree. Well, thank you so much for your time. I hope you all enjoyed that. So thank you and take care. See ya.
Bye.